Question 1. A 68-year-old patient with a history of COPD suddenly becomes restless, with SpO2 dropping from 92% to 84% on 2L nasal cannula. The nurse notes diminished breath sounds and use of accessory muscles. What is the nurse's priority action? A. Increase oxygen to 6L via nasal cannula. B. Place the patient in high Fowler's position. C. Administer prescribed bronchodilator. D. Call the rapid response team. Answer: B. Place the patient in high Fowler's position. Rationale. Positioning is the fastest immediate intervention to improve ventilation before escalating oxygen or medications. Question 2. A postoperative patient reports sudden chest pain and dyspnea. Vital signs show HR 122, BP 8856, RR 28. What is the nurse's first action? A. Administer oxygen via non-rebreather mask. B. Notify the provider. C. Initiate 4 fluids. D. Obtain ECG. Answer: A. Administer oxygen via non-rebreather mask. Rationale: suspected pulmonary embolism. Oxygenation is the immediate priority before diagnostics or notifications. Question 3. A patient receiving 4-heparin develops hematuria and bleeding gums. What is the nurse's priority action? A. Stop the heparin infusion. B. Notify the provider. C. Check APTT level. D. Administer protamine sulfate. Answer: stop the heparin infusion. Rationale: active bleeding requires immediate cessation of the anticoagulant before further interventions. Question 4. A diabetic patient becomes confused and diaphoretic. Blood glucose is 48 mg per deciliter. The patient is conscious. What should the nurse do first? A. Administer 4 dextrose. B. Give 15 g of oral glucose. C. Call the provider. D. Recheck glucose in 15 minutes. Answer: B. Give 15 g of oral glucose. Rationale: conscious hypoglycemic patient oral glucose is fastest and appropriate initial treatment. Question 5. A patient receiving blood transfusion develops chills, fever, and back pain after 10 minutes. What is the nurse's first action? A. Stop the transfusion. B. Administer antipyretics. C. Notify the provider. D. Increase 4 fluids. Answer: stop the transfusion. Rationale: suspected transfusion reaction, immediate cessation prevents further complications. Question 6. A patient with increased ICP suddenly develops bradycardia, hypertension, and irregular respirations. What does the nurse recognize? A. Hypovolemic shock. B. Cushing's triad. C. Neurogenic shock. D. Early sepsis. Answer: B. Cushing's triad. Rationale: classic late sign of increased ICP requiring urgent intervention. Question 7. A patient with potassium level of 6.5 milliequivalent/L shows peak T waves on ECG. What is the nurse's priority action? A. Administer 4 calcium gluconate. B. Restrict potassium intake. C. Give loop diuretics. D. Monitor vital signs. Answer: A. Administer 4 calcium gluconate. Rationale: stabilizes cardiac membrane immediately in life-threatening hyperkalemia. Question 8. A postpartum patient saturates a perineal pad within 10 minutes. What is the nurse's first action? A. Administer oxytocin. B. Massage the fundus. C. Call the provider. D. Start 4 fluids. Answer: B. Massage the fundus. Rationale: most common cause is uterine atony, fundal massage is immediate intervention. Question 9. A patient with sepsis has BP 82/50 despite fluid resuscitation. What is the next priority? A. Administer vasopressors. B. Give antibiotics. C. Monitor urine output. D. Draw blood cultures. Answer: A. Administer vasopressors. Rationale: persistent hypotension after fluids indicates need for vasopressor support. Question 10. A patient suddenly develops stridor after extubation. What is the nurse's first action? A. Administer nebulized epinephrine. B. Reintubate immediately. C. Call respiratory therapy. D. Provide humidified oxygen. Answer: A. Administer nebulized epinephrine. Rationale: stridor indicates airway edema, rapid medication can reduce swelling before invasive steps. Question 11. A client with diabetic ketoacidosis, DKA, has a blood glucose of 620 mg per deciliter and potassium level of 3.2 milliequivalent/L. Which action should the nurse take first? A. Start insulin infusion. B. Administer potassium replacement. C. Initiate 4 fluids. D. Check urine ketones. Answer: B. Administer potassium replacement. Rationale: insulin will further decrease potassium levels, risking fatal arrhythmias. Potassium must be corrected first. Question 12. A patient with a tracheostomy suddenly becomes restless and oxygen saturation drops to 85%. What is the nurse's priority action? A. Suction the tracheostomy. B. Increase oxygen flow. C. Call the provider. D. Replace tracheostomy tube. Answer: A. Suction the tracheostomy. Rationale: most common cause is mucus plug, airway clearance is the immediate priority. Question 13. A patient receiving morphine 4 becomes difficult to arouse with respirations of 8 per minute. What is the nurse's first action? A. Administer naloxone. B. Stimulate the patient. C. Apply oxygen. D. Call rapid response. Answer: B. Stimulate the patient. Rationale: first attempt to stimulate breathing, if ineffective, proceed to naloxone. Question 14. A client with chest pain has ST elevation on ECG. What is the nurse's priority action? A. Administer aspirin. B. Prepare for PCI. C. Give nitroglycerin. D. Obtain cardiac enzymes. Answer: A. Administer aspirin. Rationale: immediate antiplatelet therapy reduces mortality in suspected STEMI. Question 15. A patient with a history of heart failure presents with crackles and dyspnea. Which intervention is priority? A. Administer 4-furosemide. B. Restrict fluids. C. Monitor weight. D. Elevate legs. Answer: A. Administer 4-furosemide. Rationale: rapid diuresis reduces pulmonary congestion and improves breathing. Question 16. A patient with a nasogastric tube suddenly develops abdominal distension and vomiting. What is the nurse's first action? A. Irrigate the tube. B. Check tube placement. C. Increase suction. D. Notify provider. Answer: B. Check tube placement. Rationale: displacement may cause ineffective drainage and complications. Question 17. A client receiving magnesium sulfate for preeclampsia has absent deep tendon reflexes. What is the priority action? A. Stop infusion. B. Administer calcium gluconate. C. Notify provider. D. Monitor respirations. Answer: stop infusion. Rationale: loss of reflexes indicates magnesium toxicity. Stop source immediately. Question 18. A patient with suspected meningitis is admitted. What is the nurse's priority intervention? A. Initiate droplet precautions. B. Administer antibiotics. C. Perform lumbar puncture. D. Monitor vital signs. Answer: A. Initiate droplet precautions. Rationale: prevent transmission before confirming diagnosis. Question 19. A burn patient develops hoarseness and soot in sputum. What is the priority action? A. Administer oxygen. B. Prepare for intubation. C. Give 4 fluids. D. Assess airway. Answer: B. Prepare for intubation. Rationale: signs of inhalation injury, airway can rapidly close. Question 20. A patient with atrial fibrillation has a heart rate of 150 bpm and is unstable. What is the priority intervention? A. Administer beta blockers. B. Perform synchronized cardioversion. C. Give anticoagulants. D. Monitor ECG. Answer: B. Perform synchronized cardioversion. Rationale: unstable tachyarrhythmia requires immediate electrical intervention. Question 21. A patient with acute asthma exacerbation is wheezing loudly but suddenly becomes silent with increasing dyspnea. What is the nurse's priority action? A. Administer bronchodilator. B. Apply oxygen. C. Prepare for intubation. D. Assess peak flow. Answer: C. Prepare for intubation. Rationale: silent chest indicates severe airway obstruction and impending respiratory failure. Question 22. A client with hypocalcemia reports tingling around the mouth and fingers. What is the nurse's priority action? A. Administer calcium gluconate. B. Encourage oral calcium intake. C. Monitor ECG. D. Check vitamin D levels. Answer: A. Administer calcium gluconate. Rationale: symptomatic hypocalcemia can lead to tetany and requires immediate correction. Question 23. A patient post-thyroidectomy develops stridor and difficulty breathing. What is the nurse's first action? A. Check surgical site. B. Call the provider. C. Prepare for tracheostomy. D. Administer oxygen. Answer: C. Prepare for tracheostomy. Rationale: airway obstruction is life-threatening, emergency airway access is priority. Question 24. A patient with a spinal cord injury at T6 suddenly develops severe hypertension, headache, and flushing. What is the priority nursing action? A. Lower the head of bed. B. Check bladder for distension. C. Administer antihypertensives. D. Notify provider. Answer: B. Check bladder for distension. Rationale: autonomic dysreflexia, remove triggering stimulus, often bladder. Question 25. A patient receiving chemotherapy has a WBC count of 1,000/mm superscript 3. What is the priority intervention? A. Initiate neutropenic precautions. B. Administer antibiotics. C. Limit visitors. D. Monitor temperature. Answer: A. Initiate neutropenic precautions. Rationale: prevent infection in immunocompromised patient. Question 26. A patient with liver failure shows confusion and hysterexis. What is the nurse's priority intervention? A. Administer lactulose. B. Restrict protein intake. C. Monitor ammonia levels. D. Provide safety measures. Answer: A. Administer lactulose. Rationale: reduces ammonia levels causing hepatic encephalopathy. Question 27. A patient with chest trauma has absent breath sounds on one side and tracheal deviation. What is the priority action? A. Administer oxygen. B. Prepare for chest tube insertion. C. Notify provider. D. Monitor vital signs. Answer: B. Prepare for chest tube insertion. Rationale: tension pneumothorax, requires immediate decompression. Question 28. A patient with acute kidney injury has potassium level of 6.8 milliequivalent/L. What is the priority intervention? A. Administer insulin with glucose. B. Restrict potassium. C. Monitor ECG. D. Administer sodium bicarbonate. Answer: A. Administer insulin with glucose. Rationale: quickly shifts potassium into cells, reducing cardiac risk. Question 29. A postoperative patient reports calf pain and swelling. What is the nurse's first action? A. Massage the leg. B. Apply compression stockings. C. Notify provider. D. Encourage ambulation. Answer: C. Notify provider. Rationale: suspected DVT, risk of embolism, avoid manipulation. Question 30. A patient receiving TPN suddenly develops hyperglycemia of 350 mg per deciliter. What is the priority action? A. Slow the infusion. B. Administer insulin. C. Notify provider. D. Monitor glucose. Answer: B. Administer insulin. Rationale: rapid correction needed to prevent complications of severe hyperglycemia. Question 31. A patient with a recent stroke suddenly develops difficulty swallowing and coughing during meals. What is the nurse's priority action? A. Continue feeding slowly. B. Stop oral intake. C. Notify speech therapy. D. Elevate the head of bed. Answer: B. Stop oral intake. Rationale: prevent aspiration immediately, further evaluation comes after safety is ensured. Question 32. A client with Addison's disease presents with hypotension, hyponatremia, and hyperkalemia. What is the priority intervention? A. Administer 4-hydrocortisone. B. Restrict potassium intake. C. Monitor blood pressure. D. Encourage oral fluids. Answer: A. Administer 4-hydrocortisone. Rationale: Addisonian crisis requires immediate steroid replacement to stabilize the patient. Question 33. A patient with suspected sepsis has a lactate level of 5 millimoles per liter. What is the nurse's priority action? A. Administer broad-spectrum antibiotics. B. Start 4 fluids. C. Obtain blood cultures. D. Monitor urine output. Answer: B. Start 4 fluids. Rationale: elevated lactate indicates hypoperfusion, fluid resuscitation is first priority. Question 34. A patient with a chest tube shows continuous bubbling in the water seal chamber. What is the nurse's priority action? A. Clamp the chest tube. B. Check for air leak. C. Replace the drainage system. D. Notify provider. Answer: B. Check for air leak. Rationale: continuous bubbling suggests air leak, must identify source promptly. Question 35. A patient develops sudden unilateral weakness and slurred speech. What is the nurse's first action? A. Administer aspirin. B. Activate stroke protocol. C. Check blood glucose. D. Obtain CT scan. Answer: C. Check blood glucose. Rationale: hypoglycemia can mimic stroke and must be ruled out immediately. Question 36. A patient with SIAD has sodium level of 118 milliequivalent/L and confusion. What is the priority intervention? A. Restrict fluids. B. Administer hypertonic saline. C. Monitor intake/output. D. Encourage oral sodium. Answer: B. Administer hypertonic saline. Rationale: severe hyponatremia with symptoms requires rapid sodium correction. Question 37. A patient receiving PCA morphine reports increasing pain despite frequent use. What is the nurse's first action? A. Increase dose. B. Assess pain characteristics. C. Notify provider. D. Check pump settings. Answer: D. Check pump settings. Rationale: equipment malfunction must be ruled out before other interventions. Question 38. A patient post-abdominal surgery develops sudden evisceration. What is the nurse's first action? A. Call the provider. B. Cover with sterile saline dressing. C. Place in high Fowlers. D. Reinsert organs. Answer: B. Cover with sterile saline dressing. Rationale: protect exposed organs and prevent infection/drying. Question 39. A patient with hyperthyroidism develops fever, tachycardia, and agitation. What is the priority action? A. Administer beta blockers. B. Cool the patient. C. Administer antithyroid drugs. D. Monitor vital signs. Answer: A. Administer beta blockers. Rationale: thyroid storm, beta blockers control life-threatening symptoms quickly. Question 40. A patient receiving 4-potassium reports burning at the infusion site. What is the nurse's priority action? A. Slow the infusion. B. Stop the infusion. C. Assess 4 site. D. Dilute the solution. Answer: C. Assess 4 site. Rationale: burning suggests infiltration or irritation, site must be evaluated immediately. Question 41. A patient with diabetic ketoacidosis is receiving insulin therapy. Blood glucose drops rapidly from 500 to 180 mg per deciliter. What is the nurse's priority action? A. Stop insulin infusion. B. Add dextrose to 4 fluids. C. Continue current therapy. D. Monitor potassium. Answer: B. Add dextrose to 4 fluids. Rationale: prevents hypoglycemia while continuing insulin to resolve ketoacidosis. Question 42. A patient with a head injury begins vomiting and becomes increasingly drowsy. What is the nurse's first action? A. Notify provider. B. Assess level of consciousness. C. Elevate head of bed. D. Prepare for CT scan. Answer: B. Assess level of consciousness. Rationale: immediate reassessment determines neurological deterioration. Question 43. A client with pneumonia suddenly becomes confused with SpO2 of 86%. What is the priority action? A. Administer oxygen. B. Notify provider. C. Obtain ABGs. D. Start antibiotics. Answer: A. Administer oxygen. Rationale: hypoxia is causing confusion, oxygenation is priority. Question 44. A patient develops hives, wheezing, and hypotension after medication administration. What is the first action? A. Administer epinephrine. B. Stop the medication. C. Call rapid response. D. Start 4 fluids. Answer: B. Stop the medication. Rationale: remove the trigger immediately before further interventions. Question 45. A postpartum patient reports severe headache and visual disturbances. What is the priority action? A. Check blood pressure. B. Administer analgesics. C. Encourage rest. D. Notify provider. Answer: A. Check blood pressure. Rationale: symptoms suggest postpartum preeclampsia, BP assessment is immediate priority. Question 46. A patient with COPD is on 4L oxygen and becomes drowsy. What is the nurse's first action? A. Reduce oxygen flow. B. Check ABGs. C. Stimulate the patient. D. Notify provider. Answer: A. Reduce oxygen flow. Rationale: excess oxygen can suppress respiratory drive in COPD patients. Question 47. A patient receiving chemotherapy develops a fever of 38.5 degrees Celsius 101.3 degrees Fahrenheit. What is the priority action? A. Administer antipyretics. B. Obtain blood cultures. C. Start antibiotics. D. Notify provider. Answer: B. Obtain blood cultures. Rationale: cultures must be obtained before initiating antibiotic therapy. Question 48. A patient with a history of seizures suddenly becomes unresponsive and begins convulsing. What is the nurse's first action? A. Insert oral airway. B. Protect from injury. C. Administer oxygen. D. Call rapid response. Answer: B. Protect from injury. Rationale: safety is priority during active seizure, prevent harm. Question 49. A patient with heart failure has sudden weight gain of 2 kilograms in 2 days. What is the nurse's priority action? A. Restrict fluids. B. Administer diuretics. C. Notify provider. D. Monitor intake/output. Answer: C. Notify provider. Rationale: rapid weight gain indicates fluid overload requiring medical adjustment. Question 50. A patient receiving warfarin has an INR of 6.0 with no bleeding. What is the priority action? A. Hold warfarin. B. Administer vitamin K. C. Monitor for bleeding. D. Reduce dose. Answer: A. Hold warfarin. Rationale: elevated INR without bleeding, first step is to stop the medication. If you were able to keep up with these fast-thinking scenarios, you're sharpening the exact clinical judgment NCLEX is designed to test. Keep practicing under pressure, because in real exams, and real life, speed plus accuracy equals safe nursing. Subscribe and stay consistent.